Scott Brown's Rhinology, Chapter 89, Physiology of the Nose and Paranasal Sinuses. We're going to deal with Introduction, the role of paranasal sinuses, nasal blood flow, nasal mucosal vessel capacitance, autonomic nervous system, epithelial ciliary function, effect of smoking on the nose, nasal aerodynamics, nasal cycle, nasal resistance, nasal function, defense mechanism of the nasal mucosa, effect of pregnancy on the nose, and references. Introduction. To understand the pathological process affecting nose and the paranasal sinuses, it is important to have an understanding of the normal physiological functions of the nose. The nose is a complex organ that forms an important part of the face and has multiple functions. Anatomically, the nose may be considered to have an external and internal component. The internal component forms the nasal cavities. The external component is prominent, pyramidal, and with an apex at the tip whose base is attached to the forehead. The nose projects downwards with two perforated apertures, the nostrils, which are separated by the columella. The external nose is made up of cartilaginous and bony parts. The cartilaginous part consists of lower lateral cartilages and upper lateral cartilages, both of which are in pairs. Fibrous tissue connects the cartilages. The internal nose is divided by the nasal septum into the left and right chambers. The entrance of the internal nose, the nasal vestibule, is lined by skin and it contains appendages. The rest of the nasal entry is lined by respiratory mucosa and olfactory epithelium. Each cavity consists of a floor, roof, lateral, and medial walls. The principal physiological function of the nose is to humidify and warm inspired air, as well as to remove noxious particles from the air, thus protecting the delicate distal lower respiratory tract. The nose also serves as an sense organ, housing the olfactory apparatus that allows individuals to smell substance for pleasure and defense purposes. These functions are highly dependent on the anatomical structure of the nose. The vomeronasal organ (VNO) is the peripheral sensory organ of the accessory olfactory system and is located either at the base of the nasal septum in humans or in the roof of the mouth in most amphibians, reptiles, and mammals. The VNO role is to detect pheromones and other chemical signals that initiate innate behavioral response between individuals of the same species. These chemical communications facilitate social interactions such as sexual relationships. The nasal mucosa is the first part of the airway to come in contact with external environment. With an adult inspiring up to an estimated 10,000 liters of air daily, the nasal mucosa is very vascular, containing arterioles, arteriovenous anastomosis, and venous sinusoids with a large surface area of 150 centimeters square. During normal breathing, the nose contributes up to 50% of the resistance of the entire airway, with any change in this resistance playing a significant role to the total respiratory function. These vital properties allow the nasal airway to play an important role in the normal hemostasis of the body. Role of the paranasal sinuses. The paranasal sinuses are air-filled cavities found in the maxilla, sphenoid, ethmoid, and frontal bones. They develop from an outgrowth of the nasal cavity, and hence pathology affecting the nose also affect the paranasal sinuses. Development of the paranasal sinuses vary, with ethmoid and maxillary sinuses being present at birth and frontal sinuses developing by the age of 6. However, they can also be absent. The degree of development of the sphenoid sinus differs considerably. The physiological role of the paranasal sinuses is uncertain, but a number of possible functions have been suggested. This includes the following: providing a physical buffer against injury to the face, vocal resonance, reduction of skull weight, humidification, heat insulation, and air conditioning. Nasal blood flow. Nasal blood flow plays a crucial part in the normal physiological function of the nose. It can be determined using temperature change, color change, photoelectric plethysmography, and laser Doppler techniques. There can be various combination of blood flow based on the balance between arteriovenous shunting, arterial airflow, as well as the venous pooling. The main clinical variations include hyperemia, reduced arterial perfusion and ischemia. Arteries and arterioles cause resistance, while venules and sinusoids give capacitance. The nose has an abundant blood supply from branches of both the internal and external carotid arteries. A rich vascular bed composed of predominantly arteriovenous anastomosis and venous sinusoids supply the nasal mucosa. The venous sinuses form the erectile tissue that is located on the anterior nasal septum and the inferior turbinates. They have the ability to expand and shrink, which has an impact on the nasal resistance and nasal airflow. Animal studies have shown that venous pressure has a greater impact on the nasal airway resistance, with nasal resistance increasing by 1.2 to 1.3% mmHg of venous pressure increases. Nasal mucosa vessel capacitance. Two main mechanisms, the hydrostatic pressure of blood and the autonomic nervous system, influence nasal mucosal vessels capacitance. The change in hydrostatic pressure affects the filling pressure of vessels, where increase in pressure expands the venous sinusoids. The autonomic nervous system controls the activity of smooth muscles found in the walls of the arteriovenous anastomosis, leading to changes in nasal blood flow. Other factors which also influence nasal blood flow include medication, temperature, and humidity. Figure 89.1 schematic representation of the blood supply of the turbinates. A is the arterioles, V venule, C capillaries, G intestinal glands, P venous plexus, S venous sinusoids. Autonomic nervous system. The nose, the nose is innervated by parasympathetic and sympathetic fibers, which have a profound impact on nasal physiological function. The parasympathetic fibers originate in the midbrain, where with the postganglionic fibers traveling in the maxillary branch of the trigeminal nerve and providing secretomotor supply to the mucous glands in the nasal mucosa. The primary neurotransmitters are acetylcholine, which induces serous secretion, and vasoactive intestinal peptide, which causes vasodilation of the blood vessels of the nasal mucosa. The sympathetic innervation to the nose starts from the thoracic spinal nerves, with preganglionic fibers synapsing in the cervical sympathetic ganglion. The postganglionic fibers travel alongside the internal carotid artery. Sympathetic fibers predominantly innervate smooth muscles in the walls of the arterioles and sinusoids. The primary neurotransmitter is noradrenaline, which has the opposite effect on the nose, causing a reduction in the secretomotor activity of the mucous glands and causing vasoconstriction function of the blood vessels. Drugs may mimic the effect of sympathetic and parasympathetic nerve supply. Table 89.1 gives an overview of the drugs frequently used and their mode of action on the nose. Table 89.1, drugs acting on the nasal mucosa. Drug group, mode of action, example. Sympathetomimetic and their antagonists. Mode of action, compounds act on alpha 1 receptors and cause vasoconstriction. Example, adrenaline and noradrenaline analogs. Cocaine blocks uptake of noradrenaline in nerve endings, also acts as a local anesthetic. Drug used for hypertension, such as beta blockers. Drug group, parasympathomimetics and their antagonists. Compounds act to cause vasodilation and increases nasal secretion. Pilocarpine causes vasodilation and watery secretion. Ipratropine bromide blocks muscarinic receptors, thus preventing acetylcholine from binding. Antihistamines block H1 receptors. Histamine is mainly found in mast cells and causes vasodilation and increases plasma leak from capillaries. Example, antihistamines. Local anesthetic inhibit sodium channel influx, therefore reduce the rate of depolarization or repolarization. That is, example is lignocaine. Epithelium ciliary function. There are three types of epithelium in the nose. First, there is squamous, also referred to as transitional epithelium, that consists of the Vimbriciae, sweat glands, and nasal vestibule, sebaceous glands. Second, there is pseudostratified columnar epithelium that covers two-thirds of the posterior nasal cavity. This epithelium consists of ciliated as well as non-ciliated columnar cells, basal cells, as well as mucin-secreting goblet cells. The nasal epithelium is located on the lamina propria and the basement membrane, which are served by capillaries that facilitate fluid flow through to the nasal mucosa. Finally, there is the olfactory neuroepithelium that forms the supromedial portion of the superior turbinate, nasal root, and superior septum. There are various types of cells in the olfactory epithelium, but the more common are Bowman glands and ducts, bipolar receptor cells, sustentacular cells, and microvillar cells. Cilia are located on the surface of the respiratory tract, and their role is to push mucus backwards towards the nasopharynx. The ultrastructure of all cilia remain the same. However, nasal cilia are somewhat short. The surface membrane of the cilium encloses an organized ultrastructure. The nine outer paired microtubules enclose a single inner pair of microtubules. The outer pairs of microtubules are linked to one another by nexins and to the inner pair of microtubules by central spokes. In addition, outer pairs of microtubules have both outer and inner dynein arms that are made up of an ATPase. There are two layers of nasal mucus film. The lower layer, that is more watery and cilia move freely, and the upper viscous layer. Importantly, there are small hooks on the top tips of the cilia to facilitate their movements once they enter the viscous layer. At body temperature, cilia beat frequency ranges from 7 to 16 Hz. The frequency usually remains constant when the temperatures are between 32 to 40 degrees Celsius. The cilia can beat rapidly in a propulsive stroke and slowly during the recovery phase. Notably, the propulsive period is characterized by the cilium straightening while the tip points to the viscous layer. The recovery phase sees the cilium bending over in the aqueous layer. During this process, the adenosine triphosphate ATP is converted to the adenosine diphosphate ADP using the enzyme ATPase that is found in dynein arms. This magnesium ion Mg2 plus dependent reaction produces energy. Motion occurs whenever there is sliding of the outer pair of microtubules against one another. The mitochondria located near the cell surface next to cilia's basal bodies generate ATP. Metachronous movement of the cilia propels the mucous blanket backwards. Thus, only those cilia that are at the right angles to the direction of the flow form the face. Cilia that are in flow direction are out of phase until the cycle completes. From the front of the nose, mucus flows posteriorly. Thereafter, mucus from the sinuses and from the lateral wall joins together with the most passing through the middle meatus. The majority of mucus then passes around the Eustachian orifice before it is swallowed. The nose is constantly changing environment where slight fluctuations can affect the function of cilia. Dry conditions stop ciliary action, and at temperatures below 10 degrees Celsius and temperatures above 45 degrees Celsius, ciliary movement stops. Isotonic saline preserves the activity of cilia. However, if the solutions are 5% above or 2% below the normal isotonic saline conditions, paralysis occurs. Likewise, potassium ions do not affect ciliary function except when the levels become non physiological. Furthermore, cilia can beat above pH 6.4 as well as function in a slightly alkaline medium of up to pH 8.5 for a prolonged period. Infections in the upper respiratory tract can cause damage to the epithelium and function of the cilia also deteriorate with age. Effect of smoking on the nose. Tobacco contains hundreds of noxious chemicals and when smoked can irritate the lining of the nose, resulting in increased nasal secretions and congestion caused by impairment of mucociliary clearance. Smoking causes a reduction in the number of cilia and change in mucus viscosity. Studies have shown that 8 hours after exposure to tobacco smoke, the efficiency of mucociliary clearance has reduced, with heavier smokers having more marked impact. Nasal aerodynamics. Knowledge of the aerodynamic behavior of the nasal airway provides an aid to the decision making process of the medical and surgical management of the pathological processes affecting the nose. At rest, the normal inspiratory flow rate in an adult ranges between 5 liter per minute to 12 liter per minute and has a pressure change of 50 pascal between the nostrils and the nasopharynx. During exercise, the flow rate increases with a corresponding drop in pressure, where the flow rate can increase to as much as 150 liter per minute. Fluid dynamic experiments of the nose have shown that the nasal flow is laminar as it enters the nasal vestibule with no mixing of the different air layers at low viscosity. The viscosity of the air increases as it passes through the nasal cavity, the narrowest site of the upper air respiratory tract. At this point, turbulent flow is observed in the nasal cavity with different air layers swirling together. The change from laminar to turbulent is paramount as it allows the velocity of air to reduce, thus allowing prolonged contact of inspired air with the nasal mucosa and therefore allowing the nose to perform its vital function. Figure 89.2 velocity streamlines. Velocity streamline and the values. Septal deviation and turbinate hypertrophy can cause a reduction in the cross sectional area of nasal mucosa and thus can affect the nasal function. Nasal cycle. The nasal cycle is a well recognized physiological activity whereby each side of the nose alternates the phases of congestion and decongestion. Vascular activity produces the changes, especially the volume of blood in the capacitance vessels, venous sinusoids. The changes are cyclical and occur every 4 to 12 hours, with the change being constant for each person. The nasal cycle can be demonstrated in up to 80% of adults, however, it is not easy to demonstrate in children. The physiological significance of the nasal cycle is not clear. However, resistance and airflow leads to increased cyclical secretion in the side that is experiencing the greatest flow. Several factors affect the nasal cycle. These include exercise, pregnancy, hormones, infections, allergy, fear, emotions, and sexual activity. The autonomic nervous system regulates many of these changes. Notably, vagal overactivity can lead to congestion, while high levels of CO2 present in inspired air that is produced as a result of rebreathing may reduce the nasal resistance. Hyperventilation reverses the situation. Nasal congestion may also occur due to drugs that block the action of the noradrenaline. Antihistamines also produce anticholinergic effects that can halt parasympathetic activity. This results in increased sympathetic tone that improves the nasal airway. Hormonal changes in puberty can also affect the nasal mucosa. Nasal resistance. Nasal resistance plays a crucial role in preventing the collapse of the lower respiratory tract, notably the lungs, with nasal resistance contributing to up to 50% of the total airway resistance. As nasal airway resistance is increased, it causes an increase in the negative intrathoracic pressure and in turn enhances pulmonary ventilation. Mathematically, resistance of nasal airflow is equal to the pressure of the nasal flow divided by flow rate. Nasal airflow is affected by the radius of the nose. Based on laminar flow equations, a decrease in the nasal radius can cause a fourfold decrease in the nasal airflow. The presence of laminar and turbulent flow in the nasal airway passageway is vital to the physiology of the air exchange. Nasal airway resistance is achieved through three key components. These include the nasal vestibule, the nasal valve, and inferior turbinates. Nasal vestibule. The nasal vestibule is composed of a compliant wall that can collapse in response to negative pressure caused by inspiration, thus increasing nasal resistance. A flow of 30 liters per minute is the limiting rate during inspiration at which nasal airway collapse occurs at the nasal vestibule. However, this airway collapse can be prevented by activation of the ala nasi muscle during inspiration. Contraction of this muscle results in a change of the shape of the vestibule, which leads to the reduction in the airflow turbulence without affecting the cross sectional area. Paralysis of the ala nasi, as seen in facial nerve palsy, cause the nasal vestibule to collapse during inspiration and hence increase nasal resistance. During exercise, the ala nasi muscle contracts, which increases the radius of the nasal cavity and hence reduces the nasal resistance. Expiration has the opposite effect as the positive pressure within the nasal vestibule increases the radius of the nose and in turn improves the nasal airflow. Internal nasal valve. This is the narrowest part of the nasal airway and helps to direct the airflow upwards and backwards across the anterior part of the inferior turbinate. It is found approximately 2 cm posterior to the anterior nares and has a cross sectional area between 55 to 83 mm square. The size of the inferior turbinate and erectile tissue and the position of the nasal septum determines the dimensions of nasal valve. The nasal valve is bound superiorly by the caudal end of the upper lateral cartilages and septum medially. The inferior boundary is the nasal floor, laterally is the bony piriform aperture with the adjacent fibrofatty tissue, and posteriorly is the head of the inferior turbinate. The nasal valve makes a significant contribution to the upper airway resistance and produces the most turbulent airflow. During quiet respiration, the velocity of the anterior valve ranges from 12 to 18 millipm per second. The nasal valve is often referred to as the internal nasal valve. Therefore, any change in the size of the inferior turbinate and deviation of the nasal septum at this level has an impact on the nasal valve. The nasal valve plays a role clinically and the treatment of the components that make up the nasal valve area can have a marked impact on the nasal airway resistance. The Cottl's maneuver is used to assess the narrowing of the nasal valve area at rest. The test is conducted by lateralizing the soft tissue and the nasal vestibule. It is considered positive if it improves the nasal airflow. Swelling of the inferior turbinate has a profound effect on the nasal resistance. Consequently, treatments that aim to reduce the size of the inferior turbinate have a significant effect on the nasal resistance as opposed to that of the nasal surgery that removes septal spurs. Figure 89.3 A, the direction of the inspiratory airflow. B is the direction of the expiratory airflow. Inferior turbinate. The turbinates of the nose can swell and recede, thereby reducing the dimensions of the nasal cavity, contributing to nasal airway resistance. The inferior turbinates are the part of the nasal valve area and they help the change of laminar inspiratory air into turbulent flow. The large surface area and extensive blood supply of the inferior turbinate increases the interaction of inspired air with nasal mucosa, which enables the nose to carry out its function more effectively. Pathological processes causing enlargement of the inferior turbinate by only a small incremental increase of 1 to 2 mm have been shown to lead to a significant reduction in the nasal airflow velocity down to 0.42 milli per second when compared to 0.89 m per second in the normal healthy nose. Nasal function. The nose has various physiological functions. Respiratory functions include heat exchange, filtration, humidification, nasal neurovascular reflexes, and voice modification. Olfactory functions are stimulus pathways, and there is trigeminal input. Heat exchange. The temperature of inspired air can range from minus 50 degree to 50 degrees Celsius. Since various radical groups live in different environments, the nose has evolved to suit different local conditions. Filtration. The turbinates organize the pattern of airflow, enabling the nose to exhale all of the inspired air into the air stream. This happens fairly slow around and along the ciliated turbinates. In the process, heat and energy is emitted into the inspired air streams, thereby saturating the airborne particles as well as microorganisms. Eventually, the particles and the microorganisms becomes heavier, sinking into the mucosal air layer where they are processed using enzymes and immune system cells. Olfaction. Sense of smell plays an important role in protection from danger such as fire. It is also central in forming positive and negative memories affecting individual psychological well-being, socialization and interpersonal relationships with dysfunction leading to a poor quality of life. Defense mechanism of the nasal mucosa. The nose has an important role in protective mechanism to prevent noxious substance entering the lower respiratory tract. This defense mechanism can be divided into mechanical and immunological defense. Mechanical defense. The nose is able to protect the lower airway by removing particles of approximately 30 mu and up or upwards, such as pollen in inspired air. The velocity of the inspired air drops significantly after the nasal valve. As turbulence increases, so does the deposition of particles. Particles with irregular shapes resist change to the greater extent because they have a larger surface area. Vimbriaceae only stop the larger particles. Mucociliary flow is the main mechanical defense of the nasal mucosa because it physically cleans inspired air. The mucociliary transport system is made up of cilia of the respiratory epithelium as well as a mucous blanket. The latter consists of a deeper layer where ciliary motion occurs as well as superficial thick gel layer. Viscoelastic properties enable it to trap larger particles. This mechanical defense is predominant and expel filtered particles and debris into the nasopharynx and oropharynx as well as elimination through sneezing and coughing. Immunological defense. Mucus consists of compounds that are able to neutralize antigens through innate mechanisms, learned and adaptive immunological responses. Immunoglobulin A, IgA, and immunoglobulin E, IgE, are found on the surface and they act whenever the mucosa is breached. In most cases, bacterial allergens are destroyed, but there are other viruses and bacteria that require activation of the cell-mediated immune responses. IgA is the main immunoglobulin in secretions and has distinctive characteristics. IgA has two subgroups, IgA1 and IgA2. IgA1 with a monomeric structure is frequent in serum, while IgA2 with a dimeric structure is common in nasal secretions. Immunoglobulin A constitutes 70% of the total proteins in the nasal secretions. Effect of pregnancy on nose. Pregnancy induced rhinitis (PIR) is a common problem and has incidence of about around 22%. PIR has been defined as nasal congestion that is not present before pregnancy but manifests itself in the second or third trimesters, lasts 6 or more weeks with no known allergic cause, which then resolves completely within 2 weeks of delivery. The cause of PIR is still under debate as it is the impact of the pregnancy hormones on the nasal mucosa. Studies have shown that during pregnancy there is a decrease in the mucociliary clearance and increase in nasal resistance, with estrogen having possible role in inducing histamine receptors on epithelial cells. Best clinical practice. Pregnancy induced rhinitis (PIR) is a common problem and has an increased incidence of around 22%. PIR has been defined as nasal congestion that is not present before pregnancy but manifests itself in the second or third trimester, lasting 6 or more weeks with no known allergy causes, which then resolves completely within 2 weeks of delivery. Future research. Nasal morbidity, unlike in disorders affecting the other senses, is difficult to quantify. Yet, conditions such as sinusitis are chronic and affect a significant percentage of population. Continued basic science research is desperately needed that may lead to a better understanding of the physiology of nasal function to ultimately help in better treating common nasal complaints. Key points. The principal physiological function of the nose is to humidify and warm inspired air, remove noxious substance particles from the air, also serve as a sense organ. The nose has an abundant blood supply from branches of both the internal and external carotid arteries. The venous sinuses form the erectile tissue that is located on the anterior nasal septum and the inferior turbinates. Smoking causes reduction in the number of cilia and change in mucus viscosity. Nasal cycle is a well recognized physiological activity whereby each side of the nose alternates the phases of the congestion and decongestion. Nasal resistance plays a crucial role in preventing the collapse of the lower respiratory tract, notably the lungs, with nasal resistance contributing up to 50% of the total airway resistance. Thank you.